This is a senior rehab podcast, the podcast for rehab clinicians that want to better serve older adults.
Hi, everybody. I'm Tali Spaceman.
I'm Erinn Carey.
And this is the Senior Rehab Podcast.
Shorts.
Yay. I love studies that involved multidisciplinary things. I think that we provide better service when we have a fuller picture, when we don't just look at things through our prism.
That makes sense. I just think about how difficult it is.
It is. It is very difficult, and I do not expect every research to be like that or every method that you treat people to be like that.
Right.
But it is nice every now and then to get out of your own head.
I agree. It's funny. I feel like such a Debbie Downer because all I think about are like, oh, confounders. It's just me.
You know what? You do you, girl. Today I want to talk about purpose in life.
Like my purpose and your purpose?
What is your... I'm not going to talk about that.
All right, so we're going to talk about purpose in life?
Okay, so there was an article that was published really in August of this year. Very recent, and like less than 2 months ago. In JAMA, the psychiatric portion of JAMA.
Cool.
JAMA is the Journal of American Medicine Association.
Yep.
And it was talking about the association between purpose in life and objective measurements of physical function in older adults.
Ooh.
Yes.
I like this already. It sounds fun.
Some of you know or don't know, purpose in life has been linked with a range of positive health behaviors and biological processes, like the likelihood to engage in a healthier behavior, like physical activity, or to go to your doctor for screening or preventative medicine.
How do you define purpose in life? I mean, I'm not like getting existential on you. I just want to know how they define it in the paper.
It's funny because when I just saw the headline, I was like, oh, this is like, how do you measure purpose in life? And there are questionnaires and some screening.
Of course, there are objective measures for purpose in life.
Because when you think about it, it's whether you have it or you don't. Like, you don't really ask, oh, what is your purpose in life, and talk about it for 2 hours. Do you have one or not?
I see. So it's more of a binary variable rather than like, my purpose is to paint.
Yeah, I'm gonna get into it about how they measured it in a very valid and reliable questionnaire.
Cool.
But yes, they do measure it, and it's not only yes and no. It's a little bit more than that.
I'm curious. This will be good.
Good. So it is, as I said, linked to many things. Not only better behavior, also better biological function. It has been proven that having a purpose in life reduces the allostatic load. You can call it the wear and tear of the body. It's related to how many times and how often your body goes into a stress reaction.
Okay. This is terrible. But I think of like cycles of battery life on electronic devices.
That's fine.
Okay.
You can think about that.
I'm not sure it relates.
You can think about that, but it is how unsteady your blood pressure is.
It's more like your body's adaptation to these different external stresses.
Yes.
Like how efficient your body is at saying like, whoa, blood pressure, let's bump the brakes.
Yeah. Or how many times your endocrine system has been shifted from the homeostatic of it.
Cool. That's not at all like electronics batteries.
It's not. And the reduced risk of disease, whether it's a lower risk of cardiovascular disease and cognitive impairment. Also has been related to mortality.
Wow.
Yeah, people with purpose in life have been proven to live a little longer.
Wow.
Yeah.
I mean, I guess I'm not surprised, but I'm just kind of amazed that like they have the metrics in the literature to show like you have a purpose, you gonna be good.
I know that many people don't look too seriously at research in psychology or sociology, but you should.
Yeah, clearly. I mean, if it's affecting mortality, if it's affecting physical function, that's absolutely something that we as PT should be concerned about.
Yeah, especially because we are a discipline that looks not at the length of life as much as the quality of life.
That's a good point, too.
You know what else has been proven to be related to mortality? Grip strength and
Stop it. What?
and walking speed in other things. I don't want to talk
walking
about
speed, yes, but whatever, it's fine.
Yeah, it's grip strength actually more related to survival of like prognosis of a survival of a surgery.
Oh,
for
interesting.
example. Purpose in life often viewed as a central component of well-being. I'll explain what it is. It's basically the extent on which people see their life as having a meaning.
Okay.
Several studies show that purpose in life can be modified, and that's the main thing. If we have something that can be modified, that can have a relationship to physical strength and mobility, we should actually work on that.
Interesting.
So the objective was to assess whether higher purpose in life among adequately functioning older adults is associated with lower risk of developing weak grip strength and slow walking speed over time. Because they wanted to focus on mobility and strength and functional strength. And those are the two. I'm really glad they chose those measurements of grip strength and walking speed.
Because they're also correlated with mortality?
Mm-hmm.
Okay, that makes sense.
Mortality and functionality.
Got it.
They took data for a longitudinal cohort study from the Health and Retirement Study. It's a study that has been going on since 1990.
Cool.
And every 2 years, they survey people to that study.
Nice.
Yeah. They took the data collected in 2006 and 2010, so 4 years in between. The data was analyzed between November 2016 and June 2017. Starting in 2006, about a random 50% of the HRS, Health Retirement Study, were selected to an enhanced face-to-face interview.
Enhanced,
yes.
This makes me think of like CSI when they're like, enhance. But this is different.
It is different.
Yeah.
The outcome measurements were grip strength with a handheld dynamometer. How do you say?
Dynamometer.
Okay, because I say it differently.
Say it.
Dynamometer.
You got it.
Cool. Thanks. Cool. And scores under 26 kilogram for men and 16 kilogram for women were categorized as weak. This is based on, several datas from before and what
all that normative data.
Exactly.
Yeah.
Walking speed. The responders were instructed to walk 2.5 meters.
Mm-hmm.
They gave them the before and after for acceleration and deceleration.
Oh, yeah. Okay.
Yeah.
I know what you're talking about.
And walking speed of less than 0.8 for both women and men were defined as weak.
Yeah.
As we know, the average and what we consider healthy is 1.3.
Right. That sounds right.
And to your question, how did they measure purpose in life?
Yes.
Purpose in life was assessed in 2006 using 7-item purpose in life subscale of the Reef Psychology Well-Being Scale. It's a subscale inside the General Quality of Life Well-Being Scale.
Got it.
But this one only refers to the purpose in life. It has been validated in the U.S. to a nationally retrospective sample of adults. It goes on a 6 Likert scale.
Mm-hmm.
So 6 would be I strongly agree. 1 would be I strongly disagree.
Right.
And the average is the one that was taken to analysis.
Okay.
So 6 would be that I strongly agree, and it's the best purpose in life. It's
okay. So a higher number means a higher or a better purpose in life.
Yes.
Or more defined. Because their purpose could be something terrible.
But still, it's a purpose in life.
Okay.
Even if your purpose is to make your grandchildren life miserable, it's still a purpose.
I was trying to think of an example that wouldn't make people upset, but that's perfect.
Because we all have that woman. Or men. I'm sure many of you know people older adults that once the spouse that they have been taking care of died, slowly later, like pretty often soon later, they also pass away.
Sure, right.
Because they no longer have that purpose.
Oh, things are clicking in my head. This is good. Okay.
I'm loving it. The statistical analysis, they use 5 models One was not to adjust anything, not to take into consideration sex or health or any other demographic.
Just like the raw scores.
The raw scores.
Okay.
I'm not going to extend on the others. I am going to talk about the core model. The core model adjusted for additional socio-demographic and marital status, educational level, and total wealth. Core model, as I said, there are 4 more. Results. Do you want to guess?
People who have more purpose in life have better physical function.
So, in general, you're right.
Yeah, I am.
Yeah, you're always right in general.
Oh, thanks.
More than 4,000 people with adequately functional grip strength at the baseline, 426, it's 9.5%, develop weaker grip strength.
This is a huge sample size. I just realized that. Did we talk about the sample size? That's amazing.
It is why those longitudinal study like the Framingham and the Health Retirement study are so important.
Yeah.
And among 1,461 people with adequate functional walking speed at baseline, 687 responders, which were 47%, developed slow walking speed in the follow-up.
Okay.
So they did find inverse association between higher purpose and a lower risk of developing weak grip, which was about 1 SD.
1 standard deviation. Yeah.
1 standard deviation.
Solid.
Increase in purpose in life, it was associated with about 13% decrease in risk of developing a weak grip strength level.
Okay. So not a huge amount, but not insubstantial.
So that was you remember they said about the core model?
Yes.
And the other models? In the core model, it was very much statistically significant. In the other, they did find a decrease in the risk of developing weak grip strength level, but some of them were not statistically significant.
Okay.
But in all the models, they did find correlation.
Interesting.
Purpose in life was robustly related to walking speed, however.
Really?
Yeah, that was the
cool.
one that they did find the most correlation. Across all covariant models, they found strong inverse association between higher purpose in life and lower risk of developing slow walking speed. For example, like in the core model, 1 standard deviation increase in purpose was associated with 14% decrease in risk of developing slow walking speed.
Nice.
Again, what I like about that research, you have something that you can change. Because a purpose in life is changeable. It's not easily changeable.
Right.
But it is related to things that we know have to do with, as one person once said, grip strength and walking speed are another vital sign.
Right. Yeah. This makes me think about how, like, our disciplines are so much disjointed sometimes, it seems like, where, like, the psych aspect of our treatment, like, oh, we can just refer to psych, but, like, we spend so much time with our patients. No, but this is encouraging because I feel like this highlights the importance of things like having your patients be more active in their communities, because that is one potential source of purpose. You know, like going to play bingo with the neighbors, or going on a walk with your friends, or honestly, like having a dog that you need to take care of. Yeah.
In general, we walk faster when we have where to go, walk to.
I was thinking about that, how, like, the phrase walking with purpose means you're walking quickly. Yeah.
And people with purpose walk faster because they have somewhere to walk to.
Yeah.
They, if not statistically significant in all models, hold on to life.
What? Wait, say
Their
that again?
grip strength.
Oh,
so they hold on to life.
Yes, that took me a second. Sorry. They do. They hang on to it and they walk with purpose because they have purpose. Okay, so in summary, I just want to make sure I got this. This was from a longitudinal cohort study where they looked at all these different older adults and measured how much, like, sense of purpose they had and how it was correlated with their grip strength and their gait speed, which are metrics of physical function.
Not really correlated with the initial gait speed and grip strength, but with what happens over 4 years.
I see. So they take those initial measurements of purpose, grip strength, gait speed. Over 4 years, they see what happens where, like, if there are changes, like reductions in those speeds and strengths, and how that correlates with their sense of purpose.
Mm-hmm.
Cool. Well, that was really educational. Thank you, Tali.
I'm really glad.
Thank you all for listening to Senior Rehab Podcast Shorts. I'm Erinn Carey.
And I'm Tali Spaceman.
And as always, stay funky.
Hit me! Thank you for listening to the Senior Rehab Podcast. If you enjoy this content, I highly encourage you to go to seniorrehabproject.com, where you can find more helpful episodes, lots of free resources, and to see how you can become a game changer and influence the direction of this movement. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky.